Why does cardiopulmonary resuscitation, or CPR, matter so much, and what role does a pharmacist play in it? These are questions that a recent study sought to answer by exploring the practice of CPR services by pharmacists in Saudi Arabia. It is published in International Journal of Pharmacology and Clinical Sciences 2022, its Saudi journal with impact factor 0.76. The study analyzed a cross-sectional survey that delved into various aspects, from the demographic information of the pharmacists, the availability and participation of CPR teams, to the activities performed by pharmacists during a CPR code. The survey also looked into the medications primarily used for CPR and the implementation of pharmacy CPR services. A total of 439 pharmacists responded to the questionnaire. The respondents were spread across the country, with more than a third from the central region, a quarter from the eastern part, and a fifth from the southern region. Interestingly, males responded slightly more than females. The majority of the respondents were in the age group of 36 to 45 years and 46 to 55 years. When it came to training, most pharmacists had gone through basic life support, advanced cardiac life support, pediatric cardiac life support, and neonatal cardiac life support courses. The bulk of pharmacists participated with the adult CPR team, followed by the neonates and pediatric CPR teams. Emergency and medical specialties had the highest participation of pharmacy personnel in CPR codes. During these codes, the primary activities of pharmacists were the administration of medications, preparation and dispensing of medications, and providing drug information. The most used medicines during advanced cardiac life support were amiodarone, dobutamine, and procainamide. The average score of implemented items for CPR services was a commendable 4.09 out of 5. The mission of CPR element scored the highest, while the policy and procedure of CPR received the lowest score. But what do these findings mean? The conclusion drawn from the study is that while pharmacists are involved in CPR practices, their full participation in CPR services is still insufficient in many healthcare organizations. Their participation in the CPR code is crucial, as they provide distributive and clinical services that can prevent drug misadventures and improve patient clinical outcomes in Saudi Arabia. In essence, the role of pharmacists in CPR services is crucial and needs to be further emphasized and enhanced in healthcare organizations. Their expertise can significantly contribute to the successful execution of CPR, ultimately saving more lives.